Hello, my name is Antonio Wa. I'm a US and UK trained endothelial consultant and neurologist. I raise concerns about the risk to both patients and healthcare givers of contracting an airborne infection. There has been increasing use of remote consultations, typically telephone or video consultation modes of evaluating patients. This has also generated concerns about safety of these assessments. I would like to use the next few minutes to say how I would conduct a video consultation of a patient complaining of nasal obstruction. However, before I go into specifics, I'll just go into basic anatomy. The nose itself is surrounded towards the sides by the sinuses, and slightly above that, the orbital cavity, which contains the eye muscles which move them around, and nervous and blood vessels. On the roof, you have the brain, skull base, which consists of bone, along with fluid which bathes the brain, which, if injured, can cause a leakage into the nasal cavity. The floor is formed by the roof of the mouth, and at the back, you have the nasopharynx, which is part of the throat. This houses the eustachian tube opening, which leads to the ear and helps with equalizing the mid-air pressure there, which is important for it to be able to hear. It also contains lymphoid tissue, and there are also a whole lot of nervous tissue and blood vessels, which can be affected by disease. Now, the sense receptors are on the roof of the nose, and this has a modulatory function on the taste. And within the nose, you have out pockets called turbinates, which help to humidify the air and also help with filtering some of the particles away from the airway. Now, the nose itself acts as a conduit whereby air goes to the lungs from the nose, and obviously needs to be filtered out so that you have reduced amount of dust getting inside the lungs. There's a transport mechanism which helps to shift things either outwards, which you sneeze out, or it goes backwards, where you either swallow it, cough it out, or less elegantly, spit it out. Now, all these structures may be part and parcel of a disease, and this would help you evaluate the patient, especially if you use this in questioning the patient regarding his symptoms. Now, in terms of the video consultation, one would also want to get a good history and also do a visual assessment. Now, in terms of nasal obstruction, the first thing you want to know is the type of nasal obstruction that the patient has. You want to know if it's persistent, which would suggest there's a structural problem within the nose, or if it's intermittent, which may well suggest a physical change or maybe an inflammatory change. You also want to know if it's unilateral or not. If it's unilateral and persistent, you certainly know that there's something obstructive within the nasal cavity. And if the patient complains of symptoms which include daytime drowsiness, or a complaint of dryness of the throat, or even snoring, it would suggest that they have a nocturnal problem, which may well be has also an inflammatory process, or maybe there's a postural change, which may well be physiological. In addition to these, you also want to establish whether the patient has pain around the face, and in general terms, if the patient has pain around the face and frontal headaches, it may well suggest that if they do have nasal obstruction, it's sinusogenic. However, if they only have headaches, it's very unlikely to be due to sinus disease. Now, in part of your assessment, you want to know whether it's allergic or not. So you want to know whether there's a seasonal or diurnal variation in symptoms. And if this changes with the time of the year or time of the day, it may well give a clue as to what the underlying cause of these symptoms are. In addition to that, if you have a patient complaining of frequent sneezing, nasal itching, pharyngeal or orbital itching, with or without watering of the eyes, which lasts for at least an hour every day and for at least 2 weeks, then you may well suggest that this patient has allergic rhinitis, which may be chronic or acute. Apart from these symptoms, if they don't have these in addition to nasal obstruction, but have most of the other sequelae, it may well be a form of non-allergic rhinitis, which may or may not be eosinophilic, and you determine that with your various investigations, which include your blood test, to see if there's associated eosinophilia. In addition to these symptoms, or something in isolation, if the patient complains of facial numbness, which would suggest that there might be some destruction of the neural structures there, as you have a lot of sensory structures passing through the nose to the face, then you may well worry about a destructive process, which may well be neoplastic, or may well still be inflammatory, or inflammation may well be that's due to an autoimmune disorder which is destroying the bony structures and involve the neurovascular bundle. If the patient complains of bleeding, especially if it's young, in addition to this obstruction, angiofibroma, which may well influence your management. If they're much older, and especially if they're of Chinese descent, and you do find that in riverine areas of Nigeria, then you wonder if the patient has a nasopharyngeal carcinoma, especially if you're able to elicit changes like cranial nerve dysfunction or orbital changes. These orbital changes may vary from restricted eye movements, pain on eye movements, or displacement of the eye. Mind you, this may also occur with sinusitis, where you also may well have periorbital swelling, which may be tender. And these are things that you want to bear in mind when you see these patients. In addition to this, you want to elicit other history, which may well be the social history. For example, if they're woodworkers, they may well be prone to adenocarcinoma of the ethmoids. If they work in the building construction industry, it may well be associated with the materials that they're exposed to or other environmental pollutants. Other things that you may want to elicit may well be orbital changes, as I alluded to earlier, which may well suggest either a disease process coming from the nose and affecting the eye, or the other way around. So if they have either blindness in that eye, limited eye movements, displacement of the eye, you want to worry whether there's something going on that is progressing, that needs your immediate attention or referral to an ENT surgeon. Other things that you want to bear in mind: if the patient complains of crusting with the nose, this may well be a feature of an autoimmune inner ear. It may well be a feature of an autoimmune disorder, or involve you asking the patient to displace the air of the nose laterally, so that you can see if the breathing improves with that maneuver. If it does, it will suggest there's a septal deviation, partially blocking the nasal airflow. You can ask them to sniff, in which case you may see some degree of alar collapse, which will help in your evaluation of the patient. If the patient has some creasing around the nose bridge, it would suggest the patient's been rubbing their nose a lot. Redness may well give an indication as to whether there's some additional inflammatory process going on within the nose. I already alluded to cranial nerve abnormalities, which you can ask them to see if they can move their eyes freely, if they can shrug their shoulders, if they have the facial palsy. All this would suggest an additional disease process, which may well be malignant or inflammatory. In terms of investigation, you could do a skin prick test or ask for blood tests for allergies, which may well suggest an allergic basis for symptoms. If you have a patient who's been on a reasonable amount of adequate medical treatment, topical steroids, and still have this obstruction, now I think you're justifiably entitled to ask the patient to have a CT scan in the axial and reformated coronal plane to see what the sinus anatomy is like. An MRI scan is only if you suspect a neoplastic lesion going on, as MRI scans are very inaccurate in assessing sinuses. Most other investigations are only necessary if you have a high clinical suspicion, because the clinical yield is very low. I hope these few minutes have proven helpful in your assessment of patients. Stay safe. Bye for now.